Alrighty, today I'm going to be showing you how to start an IV. Hi, I'm Julie. I'll be your student nurse today. We're just going to start an IV on you. You've been losing a lot of fluids while you were getting sick. So we're just going to run some fluids and replace those so you don't become dehydrated. So the first thing I'm going to do, I'm just going to assess the arm, look for any scars, bruises, bumps, anything we want to avoid when we're starting that IV. Ask the patient to identify themselves and ask if any allergies, and I'm just going to wash the table while I'm doing this just to keep everything kind of clean. Put a towel under the hand of the patient or the arm that you are going to choose. Ask if there's any preference in IV site or any success in a certain area, and yeah, so then we're just going to look kind of where they have good veins. I'm seeing some pretty good hand veins on this patient. So I'm just going to get everything set over here on this table after it dries. Apply some gloves. Made sure the patient had no allergies. Don't know if I said that or not. Alrighty. And then once the table is dry, I'm gonna open our stuff over here and I'm gonna apply the tourniquet and just see if I can get any veins to pop out at me, really. I'll get them out here. So it's gonna be a little tight. Sorry if any pinch pulls, anything like that. We're just gonna feel around for a vein. And then once I've selected one, I'm gonna find that vein, keep that vein, and undo the tourniquet here for patient comfort. And then the first thing we're gonna do is apply our ChloraPrep, and we're gonna clean that site. And then we just crack that. And this is just chlorhexidine. You're gonna wanna rub with lots of friction, kind of all over that site for about 30 seconds. Back and forth, up and down, or you can do circles. All right. And then we're not going to want to touch that site again once we're finished with that. We can just throw it out to the side. I have selected a 24 gauge needle. I haven't selected it actually. I was given a 24 gauge needle. I would have selected maybe a 20 gauge needle for this patient. He has some bigger veins. A 24 gauge or even an 18 would be fine, but 24 is appropriate for the fluids that we are doing. So just gonna get my tape ready, and this is for stabilization, or if we have a failed IV attempt, we can always use the tape and the gauze provided in the IV start kit. I'm just gonna put that on the side of my table. On the end of my tape again here. And then we can just throw that the empty tape roll away. And then I'm just gonna dig the gauze to the top here. Might need it to clean off if we have any blood spillage or anything like that. And then use this 24 gauge needle. I'm just gonna peel it open a little bit. And then we have our J-Lube, our Posi. Should have been closed, but this is a demonstration, so we already use this one. Our PosiFlow, and then our 10 milliliter flush here. So the first thing I'm gonna do, I'm gonna get that air out of our flush. Then I'm just gonna attach it to the PosiFlow. I'm gonna open it a little bit, keeping it kind of in the package. And then there's a cap on the bottom that I'm gonna remove. And I'm just gonna prime our PosiFlow. So once you see, good. And then we can attach that to, we're gonna find our J-loop and then just uncap the end that PosiFlow attaches to. And then attach that PosiFlow. And then keeping it in the package is the best way to keep it clean. I'm gonna uncap the end a little bit. I'm gonna flush until we prime that. J-loop, and you can see there's fluid coming out. I'm just gonna recap it and keep it in the package. So it's the best way to keep it clean. All right. So then once this is dry, our site is dry, we're gonna tie this tourniquet again. Okay, I need to tie it a little tighter. And make sure it's nice and tight. And then we're gonna find our site, get our needle here, and then I'm gonna uncap that needle. So once we have our needle uncapped, we're gonna find that vein that we chose, and with the bevel up, we're gonna pull the skin taut, and then at a 15 to 30 degree angle, we're gonna insert the needle, and then once we see blood return, we can kind of slide that off the catheter off the needle. And you're gonna wanna hold pressure at the end and advance that catheter. And then once you have that, you can hold pressure on the, and then once you have that J-loop attached, I made a big mess, but it happens. Yep, it happens. To flush that, with normal saline, you would have aspirated for blood return and then flush the normal saline through. Ay, ay, ay. And then once you get that full flush, you're gonna want to clamp it right away so you don't get any more blood back, and then disconnect that from the PosiFlow, and then you're gonna want to stabilize it with either some tape or usually you use a stat lock at the facility, but we don't have any here in the classroom. So you're gonna stabilize it with some tape. Remind the patient to be gentle. You'd usually put a dressing over the top of the catheter, but we were told not to put it on the arm because it's very sticky. Find your gauze, you can clean up a little bit if you made a mess. And then you're gonna document site, date, time, site, who it was inserted by, the type of dressing used, the patient's general reaction, and yeah, I think that's it. The size, and gauge, and type of catheter used. So other than that, I think we're done. Great.